Our program today is about primary care physicians, and joining us to help define what the real role of a primary care physician is Mr. Jeff Rogers. Jeff is the Executive Director of BMG Operations. Thank you for joining us, Jeff.
Thank you for having me.
Define for us what is primary care's role in BMG and in healthcare in general.
Well, primary care is made up of several different types of primary care specialties. We have internal medicine, we have family practice, we have pediatrics, and we also have our walk-in clinics as well as our urgent care clinics. The primary purpose, or one of the primary purposes of primary care, is for the patient to get preventive care. The primary care doctor is very important to preventive care, for health and wellness assessments, and assuming that the patient needs specialty care, and oftentimes they do, the primary care doctor is the gatekeeper to the specialists who serve those roles for them.
Now, Jeff, in your experience in the medical field, which has been quite extensive, don't you see the fact that if people see a primary care doctor and have diseases identified early, not only does that provide better care for the patient, but it saves healthcare dollars?
Absolutely it does. Keeping the patient informed of their health care and have them connected with their physician is always a plus, and having the patient be accountable for their care.
Now, you mentioned the role of primary care as the gatekeeper. A lot of patients, if their arm hurts, they want to go see an arm doctor. Or if their toe hurts, they want to go see a toe doctor. But in that concept of the primary care doctor being the gatekeeper, how does that work?
The primary care doctor will refer the patient to the proper specialist. The specialist arranges a visit with the patient based upon the primary care doctor's recommendation. The patient goes to the specialist, they see the specialist, he addresses the need there and reports back to the primary care. That way the primary care doctor is always an informed physician on the total care of the patient.
What type of integrated system does BMG have to help the primary care doctors get patients to specialists?
Well, currently, our primary care physicians have a referral line that BMG has developed for the practices, the physicians, to be able to call this referral line. And the referral line then has a network of BMG physicians and other community physicians within the Baptist community that can help take care of the patient.
In our last minute, Jeff, if someone is looking for a primary care physician right now, maybe in the BMG system, how do they access a primary care doctor?
Good question. There's an online website called www.baptistdoctors.org. They can go to that website, select Find a Doctor, and they can see the different types of doctors that are available in the community.
Right.
We also have a telephone number, 901-227-DOCS, D-O-C-S.
Okay, thank you for being here, Mr. Rogers. Pleasure to have you.
Appreciate it.
This is Dr. Mark Castellaw with Health Matters. Continue to watch. We have more exciting guests to come.